Do you know your blood group? When you visit the hospital to test for blood grouping, you can either be blood group A, blood group B, blood group AB, or blood group O. They not only tell you that but also confirm if you are Rhesus positive or Rhesus negative. Have you ever heard of hemolytic disease of the newborn? It occurs when the red blood cells of the baby born is constantly being broken down. We all know the work of the red blood cell is to transport oxygen around the body. When it's broken continuously and there's not enough red blood cells in the body, it means there is no enough oxygen delivery to the tissue. This condition leads to death of a lot of newborns. But how does it come about? It's either the blood group of the mother doesn't match with the blood group of the baby, or the rhesus factor of the mother doesn't match with the rhesus factor of the baby. When a rhesus negative mother get impregnated by a rhesus positive father, hemolytic disease of the newborn can develop. In the first pregnancy, no problem will occur, because at that point the child will be rhesus positive but the mother is negative, but hasn't developed antibodies. But during delivery or maybe during pregnancy, some blood of the baby can leak into the mother's system and cause development of antibodies. Do you know the work of antibodies? It is to fight a foreign body. So in the next pregnancy, the body of the mother will detect the fetus as a foreign body. The antibodies from the mother's body will move through the placenta to the baby and start fighting the red blood cells of the fetus. This can not only occur because of the rhesus factor but also if the mother is a blood group O, and she is carrying a baby who is blood group A or B. Blood group O have antibodies A and antibodies B. It can fight the blood group of the fetus. But in most circumstances, hemolytic disease of the newborn is due to the rhesus factor. How do we know a baby has hemolytic disease of the newborn? When he is born, he will have severe anemia. The body will try to compensate to make more blood by overworking the liver and the spleen. This will cause the two organ to be bigger. The baby will be pale. He will have difficulty breathing. He will be swollen, and also when you check the placenta when the baby is born, it will be large. This condition can be treated, but also it can be prevented by giving the pregnant mother who are rhesus negative anti-D injection. In most cases, the first pregnancy will survive, because the body has not developed antibodies, but others' pregnancy will not survive since the body has developed antibodies. It is advisable for every woman who is pregnant to go for blood group testing so that, in case of incompatibility, management can be done and other pregnancies can be saved.